Good morning, everybody. I hope everyone's doing well. Welcome to our Grand Rounds today. So my name is Kina, and I will be a host. And today's presentation is going to be by the ChildLife Foundation. So the ChildLife Foundation is a nonprofit organization dedicated to improving pediatric health, access, and emergency care services in Pakistan. Founded in 2010, ChildLife has introduced innovative solutions and initiatives to address the critical healthcare needs of children, particularly in underserved and economically disadvantaged areas of the country. ChildLife conducts training programs, workshops, and for healthcare professionals, nurses, paramedics, and enhancing their skills and knowledge in pediatric emergency care. These efforts improve the overall quality of the healthcare services, and ChildLife is actively involving in raising awareness about child health and safety through its preventive health program. So let's give a warm welcome to our presentation today and our presenters. So I'm going to hand it over to ChildLife Foundation, and they will start the presentation.
Thank you so much. My name is Ahson Rabbani. I'm the CEO of ChildLife Foundation, and I have my colleagues, Shehzad Zaki, who heads our communication team, and Mohsin, who heads our services team and telemedicine, so join in this meeting. So we are really honored by this opportunity to share what we do. Let me share a summary slide with you first. And this, introducing Pakistan, we are a country of 240 million population, where children, which is less than 15 years old, population is about 100 million. We do two things. One is we manage government hospital emergency rooms, and the network has expanded to 12 hospitals. We treat about 1.2 million children annually at the cost of $7 a child. The people are not charged anything. And the impact has been that the survival rate of critically ill children has quadrupled. And we are currently in collaboration with Coast General Hospital in Mombasa to replicate the pediatric ER. So that's one way we are addressing the health issue. The second and more relevant issue is that we provide telemedicine consultations. These are done by pediatric specialists, especially not only they have a postgraduate degree in peds, but also they are specialized in pediatric emergency medicine. This service is provided 24/7 using a high-definition camera and an IP phone. We have a nurse at the other side, and using a 2 MB bandwidth, we have at the control room about 40 specialists. So currently, we are present in about 200 hospitals. We do about 500,000, 500,000 consultations a year. The cost is about $4 a consult. And in 60% of the cases, we add value by improving the diagnosis or improving the dosage. And one of the things we want to explore is, through global rounds, is the interest in using the pediatric emergency specialists at ChildLife to improve services at any one of your sites. Okay, so moving on, the challenge in Pakistan is that we have 1,000 children who die daily below the age of 5. We have a very high child mortality, and we focus on emergency because if ERs are fixed or improved, you can reduce this by 50%. So this is a typical government ER, which has poor infrastructure, unattentive staff, lack of medicines, and what we do is we transform into something like this, where we have 100 staff per site, and we provide free medicines and diagnosis and treatment. And these are very busy emergency rooms, about 300 to 400 patients a day. So this is once we take over these ERs, this is how they look. And we are running 12 ERs, emergency rooms at government hospitals. But these large hospitals are located in tertiary care hospitals in major cities. So we wanted to move to county hospitals in rural areas. And this is what this is the reason for it, because 2/3 of Pakistanis live outside major cities. This is a picture of the high definition camera we use and the IP phone that we deployed at each of these sites. We have a nurse who consults with us, or a doctor at the secondary care hospital. And on the right side, you see the picture of the control room, which is run 24/7 by pediatric emergency specialists who provide this consultation. They can, using the camera control, they can zoom in and look at a child's dilated pupils, look at the respiratory rate. If there's a cardiac monitor in the room, they can read those readings, look at the cardiac rhythms. So this is what a typical rural hospital looks like. The doctor is consulting with the central command control room. The nurse is looking at the child, and you see the camera and phone in action. And this is the other side. Different pictures, and now we have these centers in 3 cities. So we have also a disaster recovery plan. A short video to give you an idea how this looks like.
In partnership with the Government of Sindh, ChildLife Foundation has made children emergency services possible by establishing satellite centers in all districts of Sindh.
The government doctors and nurses, they call the telemedicine doctors who are working here in Karachi. They can examine the patient by focusing the high definition cameras, by viewing the cardiac monitor, and then discussing the history and examination with the doctors and nurses.
हेलो अस्सलाम वालेकुम।
वालेकुम अस्सलाम सर। सर मैंने एक पेशेंट आपसे डिस्कस करना था।
जी एहसन बताइए कौन?
ये बेड नंबर 2 पे है।
ठीक है, रेड शर्ट में जो बच्ची है?
जी हाँ।
ठीक है, इसके कोई CNS के साइंस हैं, जैसे इसका स्टीयरिंग गेज आ रहा था?
सर इसके स्टीयरिंग गेज है।
ठीक है।
इसकी सेपल है, पीपल्स इसके ब्रल है।
ठीक है।
डीप टेंडन रिफ्लेक्सेस नॉर्मल है और प्लांट।
टेलीमेडिसिन एक जदीद मेडिसिन का एक जो है बहुत बड़ा अच्छा ऑप्शन है, जिसका अभी हम लोग जो ओल्ड ग्रेजुएट हैं उनको बहुत अच्छा फ़ायदा है, क्योंकि कॉन्सेप्ट्स जो है वो चेंज हो गए, मैनेजमेंट ट्रीटमेंट के चेंज हो गए। जहाँ पे भी हमें कोई प्रॉब्लम है, जो गाइडलाइन वहाँ से टेलीमेडिसिन से हमें बिल्कुल ही जल्दी और थोड़े ही टाइम में मिल जाती है, वो बच्चों के लिए बहुत ही फ्रूटफुल है।
According to a UNICEF report, the state of child health in Balochistan is quite alarming. An estimated 111 children of every 1,000 childbirths die before their 5th birthday. In many cases, these children die simply because their parents cannot afford to take them to the hospitals in urban centers. The government of Balochistan has partnered with ChildLife Foundation by deploying telemedicine satellite centers across all district hospitals of the province. This has made it possible to provide the children of Balochistan with access to quality emergency care free of cost and close to their homes.
अस्सलाम वालेकुम।
वालेकुम अस्सलाम। हिदायत बोलो, डिस्ट्रिक्ट क्वेश्चंस।
जी हिदायत, मेरा नाम डॉक्टर सायरा है।
पेशेंट दिखाना था वैसे।
ठीक है।
पेशेंट का नाम इमरान।
ठीक है।
तो इसको कुत्ते ने काटा है।
कहाँ पे काटा है?
लेफ्ट साइड पे। थोड़ा सा ब्लीडिंग हुआ है इससे। दो जगह पे काटा है।
ओके ठीक है। और यहाँ पे थोड़ी सी स्वेलिंग भी हो रही है। ठीक है, तो अगर हम इसको कैटेगराइज करेंगे तो ये ग्रेड 3 है डॉग बाइट का। सही है?
ठीक है।
सबसे पहले तो आपने इसको सोप वाटर के साथ वॉश करना है।
ठीक है।
फर्स्ट वैक्सीन जो है इसको 0.5 ml लगेगी।
ठीक है।
ठीक है, इसके बाद इसको इम्यूनोग्लोबुलिन लगेगा रिग। आप इस पेशेंट की सारी डिटेल्स जो है आपका मोबाइल नर्सिंग ऐप के अंदर आप एंटर कर लें, तो मैं यहाँ पे आपको मेडिसिन उसके अंदर एंटर करके क्वेटा ER में इन्फॉर्म कर देंगे इस पेशेंट को। ठीक है? ठीक है। ओके, थैंक यू हिदायत। ओके, अल्लाह हाफिज़।
बच्चे इसलिए लाया था, वो तो मोशन था, तो पेट खराबी वजह से लाया था। कराची से मरीज का डॉक्टर नहीं दिखा था, ज़बरदस्त इलाज होते हैं। पेशेंट्स पर जो मैं गया था उधर से मेरे से 1 रुपये भी खर्च नहीं होता था, दवाई भी दे रहा है, तो सही तरीके से भी देखता था और सहूलत भी है।
Sharing our common vision to save the future of Pakistan.
Okay, so coming back to outside the video, what it does is that We have with a network of 200 hospitals. We have got now 80% of Pakistani population within 30 minutes access of quality diagnosis and treatment, which is available 24/7. And the quality comes from being seen by a specialist, because in rural areas, you don't get specialists, those postgraduate, I call them board certified doctors. The second advantage is that when we give this consultation to government doctors, it's their on-the-job training. So while we provide consultation on 10 cases a day, they see about 200 children a day. So whether it's pneumonia, diarrhea, it's their on-the-job learning. So if you do this coaching 10 cases a day, 365 days, year after year, that's a major factor, which better than any classroom training. So there's a 20x factor because of this training. And indirectly, while we see 500,000 children through telemedicine, indirectly, we are impacting the treatment of 10 million children. Then there's another element of a referral hub and spoke network. So if we find a child who is being treated at a rural area, needs to be sent to a major hospital, we connect them so that when the parents arrive, the hospital has the history of the child and parents do not have to run from pillar to post. Similarly, in disaster response, when we have crises like pandemic or flooding, and where roads are damaged, telemedicine network remains and continues. So the advantages are immense. It saves time for the parents and cost, because usually these rural hospitals would say, your child is very sick, is going to die, go to a major hospital, which means cost, lost wages, and delayed treatment. By providing a 24/7 telemedicine service, this is immense, and the referrals to larger hospitals have reduced. And then we collaborate with subspecialties. There's a large network of cardiac hospitals and other chains. So this is the map of Pakistan, and you can see there are about 200 dots, each representing a hospital, and we are expanding to cover all of Pakistan in the next 3 years, God willing. So that's where I stop, and thank you for your patience and look forward to your queries.
All right. Thank you so much, Dr. Rabbani, for that information. It's really inspiring to see an organization like ChildLife Foundation making such a big impact on pediatric healthcare in Pakistan. Your innovative approach and commitment is truly commendable. So with that said, I will leave it to the audience for any questions or comments. Please send them through chat or raise your hands or directly speak up. It's up, whatever works for you. Dr.
Daudi, would you like to share something about what the work you do?
Yes, thank you so much. I've loved the presentation. My question goes to, okay, so the patient has to come to those bit of us before they can get the consultation by the telemedicine. Is clear?
I'm sorry, your voice is breaking up. Kina, can you, if you're able to hear him, can you repeat his question?
Yeah, I think your audio is breaking a little bit. Do you find it more convenient to put it in the chat? To type it up in the chat, and I can read out the question out loud.
Dr. Daudi, sorry we couldn't hear it because of your voice breaking up. Would you mind typing in your query in the chat? And Dr. Daudi, where are you based? Which country?
Dr. Ahson, I think you can bring the screen so we can see all the participants.
I'm sorry, Shahzad, can you repeat it?
I think you should stop sharing your screen so we can see all the participants on one screen.
Okay.
Yeah.
Is that, yeah, okay. Much better. Dr. Sydney, anything you would like to share? Please unmute your connection. Dr. Sydney, please unmute.
Yes.
Thank you.
Dr. Sydney Smith, I practice in the Bahamas as a general practitioner. and family medicine.
Okay, great. Thank you for joining. Do you have a query for us?
Not at this time. I'll just like listen for a while.
Okay, okay.
Yes.
Are you doing anything with telemedicine in Bahamas?
Yes. Yes, we are.
Okay.
I'd like to visit Pakistan one day. It seems like such
Most welcome. We don't have as good
complex
beaches as you
country.
do.
That's true.
Excuse me, Dr. Smith uses the butterfly. You might want to ask him some questions about that.
Yes.
Please do. Please educate us about the butterfly IQ.
Yeah, I've been using the butterfly IQ, but I've had some challenges in terms of seeing the picture clear and sometimes making good of what I'm seeing. So I've had some challenges, yes.
Okay. So I can share when we were connecting all these 200 hospitals, we were always worried about the connection. But I think we have used a combination of fiber, radio, and in difficult to reach places, VSAT connections. And touch wood, our uptime is 90%. There are times when there's no electricity on the other side, but we are dealing with inpatients and who are usually in the hospital for a couple of days. So even if you have load shedding or no light for 4 hours, whenever the light comes, our doctors are able to provide a second opinion to those doctors who are maybe seen only by nurses. And now you have a board certified, American board certified doctors. So there is that value addition in diagnosis and treatment.
Okay.
Yes, Anna, Starlink is not available in Pakistan. Currently, the government has banned it. There was a lot of excitement on our part about Starlink and its potential of 100 MB downloads and uploads, but we are managing. We have good infrastructure so far. We have got more than 100 million smartphones in the country, so there's a lot of good network, and on average, people are spending 4 hours on their smartphones. Less time with their spouses, but so connectivity is not that big a problem. Dr. Daudi, to answer your question about how long has the hospital, so if you mean to ask how long we have been working for 12 years. And the telemedicine model, we have been working for the last 6 years. But it has really taken off, and we plan to add about 100 new sites this year. Nothing succeeds like success.
If you don't mind, I had a quick question. So in the past 12 years that you said you've been working the hospital and the 6 years in telemedicine, have you come across any cases where it being telemedicine has been more beneficial, has been able to, like, any specific case that still stands out to you?
Oh, sure. Oh, thank you for asking this question. We do about, in 60% of the calls, we add a value. I'll give you an example. We received a call from a rural hospital, and the doctor thought it was pneumonia. And looking at the X-ray through the camera, the telemedicine doctor said it is double pneumonia or lobar pneumonia. So instead of single antibiotic, it would be a multiple antibiotics. And so the treatment improved. Second was that this hospital, unfortunately, was not 24-hour operational. And for this serious case of pneumonia, you need to shift the child to a major hospital. So we arranged for the transfer, and we arranged for the government ambulance service to take him from this hospital to the next, which was 90 minutes away. And at the other end, at the emergency room, the doctors were ready with the history of this child who stayed for 1 day in ER and 3 days in the hospital and was discharged on the 4th day into his mother's arms. As a next step, what we are doing is we are working with the government, and we are putting cameras inside the ambulance. So the average time of 90 minutes to 2 hours of transport of this hub and spoke referral, during that 2-hour journey, we are able to provide guidance to the technician in the ambulance in case the child's health deteriorates. So that's really the impact of telemedicine. Another impact is we prevent a lot of overuse of antibiotics. Usually in case of diarrhea, rural hospitals are prescribing antibiotics, and we are changing those practices by telling them, try ORS, oral rehydration first. And it was very typical that doctors were practicing, give 3 antibiotics, the child is okay and the doctor is considered a good doctor. So overdosage is also prevented by getting this opinion. But the change comes in when you do this day in, day out, year after year. That's when practices start changing. So I think that's the real icing on the cake.
Thank you. Yeah, I do think that telemedicine, one of the reasons that I find it so interesting is that it makes every second count. And when I was treated telemedicine wise, the doctor could see me every moment. And that was really helpful. And that I think to patients also, it gave me a little bit of reassurance. I would like to wrap up this presentation. So once again, thank you so much to the ChildLife Foundation and to everyone that came to attend. Our next grand round will be on the following month's second Wednesday, and we hope to see you there as well.
Thank you so much for this opportunity. Have a good day.